Good afternoon, everyone. My name is Aya Youssef, and I'd like to welcome you all to the first Mini-Med School Series in this semester. And I really hope that you guys are going to enjoy our topic today. It's about personalized medicine in the screening for cancer, and it will be delivered by our chair's Dr. Nada Dirar. She is specialized in internal medicine, clinical genetics, and medical biochemical genetics, and we are really honored to have her with us here today. So please, Nada Dirar. This is for the camera. This is not the microphone.
That's it. Oh, this is a mic?
Yeah, this is the mic.
Alright, good afternoon everyone. Assalamu alaikum. So I'm working at King Faisal Hospital and I'm running like a hereditary cancer clinic as well as clinical genetics. So my talk today about like preventive screening for cancer. So the outline for my talk, I'm gonna give you like a brief like introduction about cancer, common cancer in Saudi Arabia, why people should get screened, and who should be screened. As well, we go like about talking a little bit about precision medicine and compare that to the older method, and common myth and misconception about screening. So cancer is like a complex group of disease where abnormal cells grow like to form like a mass or tumor. So I want you to feel like cancer is like a diabetes or hypertension. This is all complex disorder. It can develop in any organ or tissue anywhere in the body, and it's too many things like affecting like the beginning of the cancer. So it's environmental, genetics, as well the lifestyle. So the cancerous tumor draw like nutrient and from the body tissue, cross unusual boundaries and invade the adjoining parts and spread to other organs through metastasis to form a new tumor. Just gonna take this off. So what's a risk factor for cancer? There is a modifiable risk factor and there is non-modifiable risk factor. The modifiable that we can control and we can. Oh, sorry. So modifiables such as like smoking, alcohol, lack of physical activity, obesity, and diet, all these things that we can control. But there is other things that we cannot control, like age, gender, male or female, we cannot control that. Genetics, like you're born with your genetics like disease, so you cannot change it, as well prior history of cancer. So what's a common cancer in Saudi Arabia? So colorectal cancer, it's among the largest like portion like of cancer. It's related to colorectal cancer, followed by breast and thyroid. And if we want to divide that like in male and females, so in female, breast cancer is the most common, and in male is the colorectal cancer is the more common. And in female, breast followed by thyroid, and in male, colorectal followed by like the lymphoma and the leukemia, and then the thyroid and lung. So what is the screening? What is the cancer screening? So cancer screening is looking for the cancer before a person has any symptoms. So usually like a healthy person will go for the screening, not like an affected person. And of course, we all know like screening saves lives. So what are the goals for the screening test? Screening tests are not meant to be diagnosing for cancer. It's meant just for screening. Not all screening tests are helpful and must have risk. So it's important to know the risk of the test and whether it has been proven to decrease the chance of dying from cancer. And this is always like when you discuss that with your physician. So screening tests have many goals. The first is finding cancer before the symptoms occur. Screen for cancer that is easier to treat and cure when found early, like for example, colorectal cancer. If you found the polyps early, you take it off. That's very helpful. Decrease the chance of dying from cancer. Then the question, who need to be screened? So some screening tests are used only for people who have or known to have like a risk factor for a certain type of cancer, and people known to have like a higher risk of cancer than other include those who have any of the following features. A personal history of cancer, yourself like has a cancer, so you should go for screening. If you have a family history of cancer, if you have like a certain gene mutation or genetic disorder, like put you at a higher risk for cancer. Exposure to cancer-causing agents such as tobacco smoke, workplace chemicals, or just like older age. So what's the recommending cancer screening test? There is many like modalities. Could be like just physical examination and history, going just to your doctor and taking that. Could be like part of the screening. Laboratory testing, either blood, urine, could be like part also of the screening. Imaging procedures such as CT scan, mammogram, MRI, all these part of screening. Or genetic test, just a blood test, and you do your genetics like test, and it could consider like a part of screening. And your primary health doctor will let you know about them when you go for your annual exam at the required screening age. Let's talk about the most common cancer in females, like breast cancer. So mammogram. Mammogram is the main way for the doctor to check for the breast cancer. It's use an X-ray to create a picture of inside your breast. And a test can be often find this type of cancer when a lump or like the lump is like too small for you to feel, and before disease has spread to other part of your body. So mammogram is like considered like the gold standard for like screening in breast. So this is like an old like slide, but like just to show you, like 69% of Saudi women does not undergo like breast cancer test, and only 10.6% like do like a mammogram. And also just to let you know, like only 5 to 10% of the cases of breast cancer are related to genetics or hereditary. So the rest, it's like could be sporadic or could be like environmental or other factors. So screening according to your age. If you remember in the previous slide, I said like when you go to your doctor and we'll discuss the screening according to your age. So for breast cancer, for women aged like 40 to 44, that's what when the women should start screening for mammogram every year. But when you reach like 45 to 54, a mammogram has to be like, it's like mandatory according to the guideline recommendation. You do the mammogram every year, and above 55 as well. So what I want you to know, like when you do like the breast cancer screening, does not prevent breast cancer, only detect breast cancer early, so reduce the chance of dying from breast cancer, and does not reduce the breast cancer risk. So screening, just a screening, is not diagnostic or... So talking about the colon cancer screening, which is the most common cancer among male, all male and women at average risk should be start screening at age of 50, regardless your family history, regardless if you have a genetics disease. At age of 50, you should start doing the colonoscopy. And since the disease usually starts with a growth called polyps inside the colon, a part of your digestive system, some screening tests look for them. So there is like a different modality for doing like a screening for colorectal cancer. So colonoscopy, it's the best one. And then like stool test, because you know, like sometimes patients refuse to do colonoscopy. It's like an invasive and like it's required like a 1 day, like sometimes like stay in a hospital or something like 1 day surgery. But it's not comfortable for most of the patient. So they choose to do like a stool test or stool DNA test, or sometimes they just like opt for flexible sigmoidoscopy, which is only like a part of like the colon, but it's not the whole colon. Or sometimes people like decide to do like, they don't want anything, they want to do like a CT scan. It's could consider also like a part of the screening. All right, talking about precision. I know like nowadays everyone is talking about precision medicine, personalized medicine. It's like the new era like in medicine right now. So what's the precision oncology or precision medicine of cancer? It's focusing on matching the accurate and effective treatment for each individual cancer based on the genetic profile of the cancer of the individual. So the way that I want you to know or understand the precision medicine is just finding the right diagnosis as well finding the right treatment for that person. That's basically what's precision medicine. So it could help in prevention, in diagnosis, and in treatment. In prevention, like early detection of patient at risk and improve a preventive measure. In diagnosis, having the accurate diagnosis based on the molecular test of that person, so you have the accurate diagnosis for that person. And then treatment, of course, like improve the outcome through target treatment and reduce the side effect of medication. So the current medicine is like, for example, cancer patient with colon cancer, given like a specific type of treatment or chemotherapy, and it's gonna work for all patients. It's not tailored or customized to that person. Whereas like a future medicine and personalized medicine is in having like patient with cancer, do genetic testing through their DNA and confirm like which mutation, which variant that caused that cancer for that patient, and then based on that variant, like target treatment for that variant. So it's like customized, like will have like better effect, less side effect. All right, so common cancer screening like misconception. I'm gonna tell you like what the story and like what the truth. So sometimes like patient like young, they say like I'm still young and healthy, I don't need any health screening. Or sometimes they say to you like blood tests for unhealthy people. Like healthy people, they don't go and do like a blood test. And I'm feeling healthy, therefore like I don't need it. So that's like very like wrong. It's like detect the things early, treat the things better. Other things like people always hear like cancer is fatal or like a deadly disease. It's like, this is something like it's very fatal, I don't want to get it. Of course, nobody wants to get it, but like the modern medicine has made a huge stride in the cancer treatment. Just to let you know, like the most advanced things in genetics is cancer right now. It's like, like the only thing, like, not only thing, like one of the among things that in genetics, we really have like a target treatment and target therapy and really like a good outcome. So it's estimated that 40% of people diagnosed with cancer disease are free in 5 years. That's what all like most of the guidelines when they do like the treatment or like the recommendation, it's based on the 5-year surveillance. So the 5-year survival rate is very important benchmark to predict the overall recovery from the cancer, and early diagnosis and detection greatly improve the survival rate. Another thing, like you always hear, like in my clinic or in the street or like when you go to in public, that there is no one in my family has ever had breast cancer or had a cancer, so I don't really need to do it, or I don't really need to worry about it. So just to tell you, like about 8 of 10 breast cancer are diagnosed in women who have no family history of other disease or have no family history of breast cancer. So it's not necessarily like if your mom and like your aunts like has no cancer or breast cancer, like it's mean like you're free and you're not getting a chance to get like a breast cancer. So breast cancer, like among of like the autosomal dominant genetic disease, so it's mean only one variant that will lead you like to have the cancer. So it's mean like you could inherit that from your mom and dad, or it could have de novo, like the mutation or variant happen in you, and then like you will inherit that to your children. Another thing to say, like, if I'm going to get breast cancer, there is nothing I can do about it. That's totally wrong. That's a really wrong message. There is things you can do. We know that when breast cancer is found early, where it's small, before it has spread, the chance of successful treatment is very high. You always like hear this story, like woman has like a breast cancer, she took off her breast or like either unilateral or bilateral, and like she lived for almost like 20 or let's say 15 years after that, free of cancer. So mammogram can find the tumor when it's very small, and finding breast cancer early also means that the woman has a chance to saving her breast. It's better because doctor may able to remove the tumor only or small area or nearby tissue. And if you have found it like an early, so you could take that lump and go to your doctor for cosmetic, and like they will implant like a breast for you. So if I get a mammogram, they are going to find the breast cancer. That's not true. So we're doing that for screening. It's not necessarily like you having a mammogram that you will end up having a breast cancer. So most mammogram results came back normal. And that's what we want. We want it to come back normal. And if suspicious area found on that mammogram, the doctor will send you to different modalities. Sometimes either more details or send you to MRI to really classify that suspicious area. Or sometimes just basically taking a biopsy from that suspicious area, and they will see if it's cancerous or not cancerous. I have lived this long without getting breast cancer. Let's say a woman in an age in her 50 or 60. Why should I bother getting a mammogram right now? So as you remember, in the beginning of the slide, there is a modifiable and non-modifiable risk. One of the non-modifiable risks is age. So getting age or getting older, that will put you at risk of cancer. So your risk of developing cancer goes up as you get older. Most breast cancer diagnosis each year in women older than 55. So it doesn't mean if you live all that long with no cancer, that means you have zero chance to develop cancer. And even after you have through menopause for women, you still need to do mammogram. And still there is a medications just tailored to patient undergo menopause. So just this is a focus slide on breast cancer. So breast cancer only affects middle-aged women. That's false. If the lump in my breast is not painful, it cannot be cancer. That's also false. I have no family history. I'm healthy and exercise regularly, so I won't get cancer. That's again false. And radiation from mammogram cause cancer or spread cancer. That's big false. Breast cancer cannot be cured. It's this sentence. No, that's not true. So I'm just going to end my talk today about cancer screening timeline. Just remember, when you go to your doctor, according to your age, there is a certain screening things. Screening for cancer as well as screening for other disorder. So at age of 21 years old, have a discussion about when to start cervical cancer screening for women. At age of 40, start a beginning of mammogram or cancer for breast screening. At age of 45, also start talking about the colon cancer screening and consider starting at age of 50, especially for men. And at age of 50, that when you should start breast cancer as well, you should start the colonoscopy. And at age of 55, have a discussion about prostate cancer screening in men. So through a blood marker, the PSA, so you start the screening at that age. And as well, at 65, you have discussion when to stop cancer screening. So we're not gonna stop it at 65. It depends how you live healthy for all this life. So sometimes they extended the screening up to age 70 or 75. And that's it. Thank you. So welcome, any question, any comment? Sure.
أول شيء يعطيك العافية.
الله يعافيك.
It was very interesting talk. I think I am more interested in the genetic screening part. First of all, here in Saudi Arabia, did they start something because at the end of the day, you want something applicable, something that they are practicing right now with the patients.
Sure.
Where are we? So where do we stand here in terms of screening genetically cancer patients as a routine work? I mean, what are the lists? What are the genetic screening tests that are already goes without saying they have to do it for any patient who is diagnosed with cancer, and is that covered by insurance? Where are
So to say they have to do it, we cannot force people to do the genetic test as well the screening. You cannot force the patient to do the screening. So in terms of screening by genetics test, it's we are doing right now, if you have a family history of breast cancer, or yourself have a history of breast cancer, previous history of breast cancer. So we are doing at least a gene panel that cover most of the hereditary cancer. So for example, in my clinic, I'm doing the panel that cover 101 gene related to breast, colon, and ovary and uterus, because like the genetics variant or mutation that cause breast cancer in women, it also could cause like ovarian cancer and uterine cancer. And exactly in the male, they also have like a breast, so they will develop breast cancer. I have like a couple of male patients with breast cancer in my clinic. So male like breast, prostate, like talk to each other. So it's basically a blood test that covers like most of the cancer gene, but if you have a family history. Talking about insurance, we know like here in our country, there is nothing called insurance right now, currently, like especially like in the big hospital. So if the patient came and say for like a genetic test, we will do that and we honor that for the patient. Talking about like insurance, like for example in outside, like US or Canada, it's covered by the insurance if you have like a really strong family history of cancer or yourself has a history of cancer. So it's covered.
So, but the patient has to request for that. It doesn't.
Of course, because like most of our genetic tests that we performed in the current practice, it has to be signed by consent from the patient himself or herself. So she has to be agreed that she wants this cancer. It's only one time like per life. You don't have to do it like every year. It's not like a mammogram, you have to do it every year. So it's one time, you do that genetic testing. You see, for example, like you have like a variant or mutation in BRCA1 or BRCA2, like the most common gene related to breast cancer. And then, so when you found that, so you mean like you're a higher risk of breast cancer compared to other people or compared to the general population. So even like the modality for screening after that, having a BRCA1 or BRCA2, it will be more frequent. So for example, women start breast mammogram at age of 40, right? Or 45. If you have a BRCA1, I will start from age of 25 years old. So because you don't do mammogram at age of 25, you do MRI because of like the dense tissue. So mammogram won't work. So you start with MRI. Because really a higher chance if you have a genetics mutation that puts you at risk of cancer. Also, like for example, like let's talk about colon cancer. So there is a genetic mutation that puts you at risk of developing colon cancer earlier than other people. So if, for example, I have a family history, my dad, my uncle has a colon cancer, I would rather start the genetic testing for that individual early on. So treatment and colonoscopy will be more frequent and treatment will be more effective. Especially for like, for example, FAP, the familial adenomatous polyposis. This is like when you have like a polyps in all your colon, it's more than 100 piece of polyps. So that you put you like at risk of develop cancer early, so you will start the colonoscopy early. Sometimes even at age of 16 years old. I know like you're, maybe like now your age around 20s, but sometimes from 16 years old, you start doing the colonoscopy. So genetics, knowing your genetics background is very important. But again, the patient has to opt for it and the patient has to choose it.
So if I may add to my question,
sure.
Education for the patient should be working hand in hand in this regard.
Yes.
Because if he doesn't know, how would he ask for it, right?
Exactly, yes. And sometimes like, because I'm working in genetics, so sometimes they like healthy couples coming to us and they have like their child have the genetic disease. And we know like sometimes if we do the genetic test for that child, it will give me like if his father and his mother at risk of certain disease. And so just doing the genetic test for that child, it will give me like if his parent also at risk of something else. And it's part of the test, and it's like a really like a long 3 pages like consent. And we will ask the patient, do you want to know if you're at risk of cancer? Do you want to know if you are at risk of cardiac disease? Because according to American College of Genetics, there is a 73 gene, which is this 73 genes associated with cardiac, as well cancer, as well other like metabolic disorder. That is kind of like a package added to the test of your child. So we're doing like we're focusing on your child. We want to diagnose your child, but there is a 73 gene that will tell us if you're at risk of breast, of any cancer, like colon, breast, or like cardiac disease. That, for example, a patient with Brugada syndrome, that the one that has like abnormal heart rate. So treatment early, it's better than to have like a cardiac sudden death. And this is like a well-known, well-studied genes. With early treatment is much better. And then sometimes you find like these couples, they said like, no, I don't want to know anything about cancer. I just want to focus on my child. And some of them, like they said, yes, we want to know everything. And one time, like I signed a consent with the patient. The next day he called me, he said, Doctora, I don't want to know anything. I said, but like I already sent your paper to the lab. And then I had to write like a documentation in my note that when the results come, I'm not gonna disclose it. Even if I found like a cancer, I'm not gonna disclose it. Because he said like he doesn't want to know it. Yeah. So genetics is great, but sometimes not all people like accept to know. Yes. Of course. Yeah, and it's like talking about the precision and personalized medicine. I think that will be like the future, inshallah, and it's like we are going toward that. For example, for pharmacogenomics. So we're doing like a genetic test for that patient to see how he's respond to the medication. So that's like we're inshallah heading toward that. Any other question? And also, like I just want to tell you, like there is like an app in your phone. It's called US Task Force. So you just like it's a free app. So you just download that, and then you put your age, men or women, and then they'll ask you like a couple of questions, and it will tell you exactly what screening that you need. Either cancer screening, either just like a hypertension screening at the age of 32. It will tell you like it's very easy. I used to do that like when I was a resident. Even like for my patients. So I'll just put that information and I'll tell the patient what screening he needs to get. Because of course, like when you graduate, are you guys like a medical student? Yeah. So if you graduate, of course, you will see like general like a patient. So that's very helpful in your clinic. Any other question?
I guess I can ask one more.
Sure.
Which is that what about patients who were diagnosed with cancer? Let's say breast cancer.
Yes.
They're diagnosed, we're not screening for them. Do they do genetic test mandatory, like a package where you have to do the following for treatment purposes?
Again, the physician, the oncology, if he sent his patient to genetics and we do the genetic testing. Of course, like for me, like personally, I believe every patient with cancer, he should get like a genetic test to find out what type of cancer he has.
I guess my question is, I'm sorry for interrupting, but allow me to just stop you and please, can I have your attention? I guess my question is there guidelines in health system? Because if it's on an individual basis, that's one thing. But if there is like a guideline that's in place in health system, because then the practice will be, not only because of someone, doctor who is interested and someone who's not interested.
Yes, so there is a guideline, the NCCN guidelines, this is just for oncology or for genetics as well. But again, it depends on certain things. It depends if you have a family history, if you have like a certain type of cancer, if you have like a certain type of blood test, that will mandate that you should go for genetic testing. But the things like not all of them have like a really specific guideline to do for genetic testing. And again, it will depend on the patient and the physician if they want to do that genetic testing. So there is a certain guideline for certain type of cancer, but not all. But for me, like personally, I believe every patient with cancer, regardless, should get a genetic testing. At least because like and you will, because your screening, your treatment, all will be changed based on that genetics diagnosis. And also like just to put in your mind, it's only 5 to 10% of all cancer, it's related to hereditary cancer. So if the patient came to my clinic, I'll tell her only 5 to 10% is related to genetics or hereditary, but the rest are not. Any other question from the student? All right. Thanks for having me. I really enjoyed it.